खुशी कौन नहीं चाहता, लेकिन किस कीमत पर? धूम्रपान महंगा पड़ता है। धूम्रपान आपके लिए हानिकारक है और आपके चाहने वालों के लिए भी। धूम्रपान पड़ेगा महंगा।
Hi, hello, namaste viewers. My name is Dr. Rahul M. Rao from Mangalore Psychiatry Center. Since lockdown, I'm pretty sure you guys have been missing the theaters, and although it looks like a pre-movie statutory warning, I'm afraid I won't be showing any movie for today. But today's topic is about tobacco dependence syndrome. It also makes more sense to have this topic because recently we observed the World No Tobacco Day, and the theme for 2020 is protecting the youth from tobacco usage. Most people think that tobacco means smoking cigarette or bidi. However, there are a lot different forms of tobacco usage, starting with chewing tobacco, sniffing in the form of nasha, what is called in local language, and also placing quids in the mouth. And there's this entity called as cheni keni, which is a mixture of tobacco and spices. Put it in a pouch and it's placed in the oral cavity. So before I go into the tobacco dependence syndrome per se, I'd like to put out the facts. As you guys know that more facts means more weightage to the topic, and also it shows how important this particular topic is. There are about 1.3 billion tobacco users in the world, and every 4 seconds there is a person who is dying because of the complications of tobacco. And at least 25% of the overall cancer related deaths can be attributable to the tobacco usage and cancers arising out of tobacco. And about 1 million deaths are occurring out of passive smoking, that is like also called as second hand smoking. There are certain other facts which I've already mentioned in my other video, alcohol dependence syndrome. However, for completion's sake, I would like to put it here. And this particular slide, as you can see, shows a study which was conducted by Nimhans in the year 2016. It shows the prevalence of tobacco usage in the country, and it amounts to about 13.1%. As you can see, tobacco usage is more than any other substance. It's mainly because of the easy availability and also the different forms of usage of tobacco. Now, a person with tobacco dependence has a strong urge or a craving for this particular substance and has a need to use it on a regular basis. And he also would develop certain symptoms known as the withdrawal symptoms when he stops consuming the usage. The withdrawal symptoms can be as early as less than 4 hours, maybe 1 to 4 hours. And also this particular individual would start with maybe 1 or 2 cigarettes per day, and over a period of time gradually increases the amount of consumption of cigarettes or the other forms of tobacco, the amount of other forms of tobacco. So once this particular thing happens, then it leads to other complications, not just mental health complications, but I'm also including the general health complications. Now, big question, why do people get addicted to smoking? It's because it just takes 11 seconds for the person who smokes to experience the pleasurable effects of smoking. And when it does, it stimulates the brain in such a way that it creates a constant need for this particular stimulation to happen over and over again. The other reason for regular smoking or maintenance of this particular smoking is to ward off the negative effects or to ward off the withdrawal symptoms. Now let's come to the withdrawal symptoms of smoking. It could be as simple as a cough, a headache, dizziness, or irritability and sleeplessness. Sometimes some individuals also express increased levels of anxiety, depression, insomnia, again as described earlier, and they also develop a particular symptom called as a mental fog, where they are not able to focus or be attentive at any particular activity. Now, Let's not forget about the physical effects of smoking, the general health conditions that are affected by smoking. Smoking can cause cancer in each and every part of the body. It can affect the respiratory system, the lungs. It can affect the heart by increased levels of cholesterol leading to myocardial infarction. It can affect the skin, causing a wrinkly skin. It can also lead to reduction in immunity. It can cause visual disturbances, also sexual problems. Now, let's come to the treatment aspect. Most people feel that I can quit smoking on my own without any medications. Some others may also feel I can do it with just some of the therapeutic exercises and without any medications. But the best approach is a combination of medicines and therapy. Under medications, we have NRTs, that is the nicotine replacement techniques, which include gums, lozenges, and sprays, nasal sprays, and also nicotine patches, which comes in various dosage forms. And there are also certain tablets for nicotine addiction. On the other hand, we have certain therapeutic techniques such as MET, motivational enhancement training, which includes teaching them about anti-craving measures, how to manage when there is a person who is having intense craving for smoking. We also have group therapies, and if required, we can also put them on a individual therapy. And mindfulness, I would not want to describe it completely because it takes more time. So mindfulness is basically living in the present than focusing on the future. The problem that lies in front of us is advertisement of tobacco related products, either directly or indirectly, with celebrity endorsements, promotion to children and adolescents by various forms, maybe different flavors, shisha, which appears like a cool thing to do, and misleading marketing techniques which advocates for the use of e-cigarettes as an alternative to quitting. This basically reduces the individual's perception of risk and harm to use of cigarettes. I hope this video was informative. Please like, comment and share so that many people can benefit from it. For more videos, subscribe to my YouTube channel. Thanks for watching. Bye.